there are mounting concerns over the increase of cholera cases. The NICD has already recorded 6 instances of infection, with 1 death reported in Gauteng. The Department of Health says the most common way cholera spreads is through contaminated or polluted water. People can become infected directly by drinking unpurified water or indirectly through contaminated food. So how do other countries deal with it? Joining me now is Dr. Alinafe Kasiya, who's the country director of the VillageReach in Malawi. Doc, thank you very much for your time this afternoon. And maybe let's start with that very question. Cholera is something that's not very common in the South African context, and now we are finding ourselves in a situation where we're going to have to deal with it and create the necessary preventative measures. So let's talk about how it's been dealt with in other countries previously and some of the initiatives that are being explored at the moment.
Good afternoon, and thank you for having me on this program. So I work for VillageReach. We are a global health organization with offices in Malawi, Democratic Republic of Congo, and also Mozambique, and also working in a dozen of other African countries. And basically, we work side by side with governments where we are looking at how we strengthen systems that deliver medicines, vaccines, but also reliable health information, especially for the hard-to-reach communities. And so on this question of cholera, I think this is a unique challenge that we're experiencing around the region. And as you have put it in South Africa as well, this is emerging as a challenge. And I must say in Malawi in the past, this has been limited to the rainy season, but for the past year, we have seen this emerging as a serious challenge for the country. So I can give you some numbers right now. So we have seen 53,000 cases so far in Malawi. We have seen over 1,600 deaths. And there was a time when we actually had to close our schools for a period, I think, just to make sure that we were addressing cholera in the schools. But the situation is improving as of now, and I think that's a lesson for all of us in Africa. So we are seeing a big improvement. We are down to, as of yesterday, 2 deaths. We have seen number of new cases declining, number of new admissions as well declining, which means I think we are doing something right as a country. So Malawi as a country has launched, the president did launch what we call Ending Cholera campaign, looking at 3 aspects. One area is actually expanding access to cholera prevention and treatment, looking at expanding access to safe water, sanitation and hygiene, but also communication. And I think on the 3rd aspect of communication is where, as VillageReach, we can talk a little bit more, because we are looking at how do we expand access to reliable information so people can make informed decisions about what they can do at home to prevent cholera. I think this is critical for one reason, which is in the current times when vaccines are limited, and we are seeing this as a global challenge, where basically vaccines are not enough. People have to be able to prevent, make decisions about prevention at home, but also understand when do they need to seek care. So VillageReach, as an organization in Malawi, we are supporting the government to basically roll out what we call the National Health Hotline, which is a health center by phone, to make sure people have access to information and they can engage directly with community, with health workers, and get first-hand information around what do they need to do to prevent cholera, but also when do they need to interface with healthcare. And I must say, I think what's important is that this is a solution that government has already accepted and government has taken on board as part of the national health system. And so as a partner, we are working with government to make sure that we're expanding this existing solution, which is part of the national health system, so that people have access to reliable health information. And that's critical in the cholera times. I think that's what we are learning. People need to make quick decisions in their homes. What can we do to prevent cholera even before we experience a case? And then when we see some symptoms, what do we need to do to access healthcare?
And we'll get to what a household needs to do to prevent an instance where someone gets infected by cholera. But from the many initiatives that you've described have been taken on by the Malawi government in conjunction with yourselves, What does South Africa need to do to prevent 53,000 cases and 1,800 deaths on average, with schools having to be closed down? Because that sounds like quite a dire consequence of being reactionary rather than being proactive. So would you say that of all the initiatives you've mentioned, the communication component one is going to be very important to make sure that we are able to keep these cases under control?
I think there are a number of points there. I think that we need to be looking at that, not just South Africa, but all of us as countries, even Malawi learning from South Africa, that we need to be looking at. And one is that government leadership. So government taking ownership of the response is critical. And so if you look at the Ending Cholera campaign, where government has taken leadership and basically, outlining the areas that we need to be focusing on in an emergency mode, that has been critical for Malawi. And I must say, related to that is our work supporting the National Health Hotline, which is we have found it to be most helpful to find a system that delivers reliable health information to people wherever they are based. And so people can make those quick decisions. And so if there's one thing I can say about South Africa and any other countries, that find a system that delivers reliable information quickly, enables everyone to engage with health workers if they have questions about how to prevent cholera, but also when they're experiencing a case of cholera, what do they need to do to access healthcare? I think that's number one, that's critical. I think the other thing that we have seen in the Malawi case, in the case of the National Health Hotline, which is primarily what we are using for health information, is that, the radical collaboration with private sector is key. So bringing on board private sector, in Malawi we have mobile service providers, like for instance, Airtel in Malawi, that has been able to expand access to many parts of the country, ensuring that people have access to services. And so people can call in using the Airtel platform, because we have that partnership with mobile service providers. And the third aspect is that I think we need all of us to be learning from equity issues that we need to be looking at. So in the Malawi case, for example, our National Health Hotline, when you think about cholera, most people who are calling in, it's men who have access to phones. And so when you talk about the hotline, you have men calling in. But how do we get more women to call in? How do we get to reach other vulnerable populations? And so I think using the data that we are getting from these solutions to inform decision-making, I think is going to be critical. And I must say, the other thing that we are looking at also broadly, not just in Malawi, are things around, for instance, how are we learning from each other? We recently had a South African delegation visiting Malawi to learn from a National Health Hotline, looking at how we are dealing with issues around emergencies, but also in a pre-emergency mode. And so we do need, I think, in this context, a lot of those exchanges, because I think Malawi can learn a lot from what's happening in South Africa, what's happening in Mozambique, because Mozambique is also experiencing the same, Zambia, what's happening in Zambia, and so on. So I think providing that opportunity to learn from each other, is critical. So I think all of us must be willing, I think, as African countries, I think, to learn from what is working where and how do we address this? Because this has emerged.
Now, unfortunately, I have to cut you off there, just in the interest of time. Doc, my apologies for coming in there, but your point has been driven through quite strongly. Thank you very much for your time this afternoon. That is Dr. Alinafe Kasiya, who's the country director of the VillageReach in Malawi, providing some insights and some learnings as we try and tackle cholera.